Dr. Chang, the message just cannot get out enough times. The best way to avoid getting COVID is what?
It's always vaccination, my friend. You know it. You've heard me say it. You've heard a lot of people say it. The people who are not saying it are the ones without the MD degrees. So we're always encouraging folks to listen to reliable sources and get off Dr. Google. Please, let's go get vaccinated.
Yeah. For some people who have gotten COVID and while they were unvaccinated, some will say, well, I don't think I need to get the vaccine anymore because I've already had it. What do you say as a response to that?
Yeah, I mean, technically for now, right after you get it, absolutely. You have antibodies, your antibody levels are going to be high, but those aren't going to be lasting. It's just one of those things. And plus remember that when you get natural immunity, you're naturally immune to sort of that strain. Your body is very specific, whereas vaccinations will be a little bit more broader response. And so the answer is always that if there is an effective vaccine, that's going to be the best way to protect yourself. That's the case with this. That's the case with measles. That's the case with chickenpox. That's the case with all of the rest of our vaccines.
What about those people that are saying to themselves, I'm just going to get it anyway. Might as well just get it over with and not worry about getting vaccinated?
Yeah, I would love to be able to guarantee that you would get it and you wouldn't have a complication, right? I mean, I think that's the real question. I mean, right now, even though it was Omicron and even though we've all heard and seen that it is less deadly than Delta, I right now have 80 patients in the hospital who are not infectious anymore, recovered from the COVID infection, but 80 people in the hospital who are still recovering from the ravages of the disease on the rest of their body. So even though the infection is cleared, their hearts still aren't strong enough for them to do even regular activities of daily life, brush their teeth, take a shower, right? Some of them have long-term COVID in terms of heart and brain disease, where some had strokes, where some now have heart failure that they didn't have before. I can't guarantee that you won't be that if you get Omicron. You've probably heard and read the story of a young lady in Europe who decided to do just that, purposely get COVID. And now she's not here. So it's just one of those things where you just don't know. Why take the risk?
Let's have some guidance here for our listeners. If they're fully vaccinated and boosted, they do catch COVID. What should they do moving forward? As far as, should they quarantine just as normal? Can they spread it just as easily, even if they weren't vaccinated? Because I think also some people will say, well, if I'm vaccinated, I shouldn't be harmful. I shouldn't be putting anybody else at risk. I should be fine. But you can still spread it, right?
Certainly if you have symptoms, right? So by definition, if you have a breakthrough infection, the vaccine unfortunately didn't work for you in terms of 100% prevention. Now, it may still prevent you from having real severe disease, and that's great. We know that happens, right? But if you have symptoms, by definition, you have COVID. And so by definition, you can definitely spread it, okay? So when we tell folks that you're less likely to spread COVID if you're vaccinated, that is, of course, true, but it's also true because COVID is so good at preventing you from getting COVID to begin with, right? The vaccine is good at prevention, right? Now, if you do get broken through, well, now you have COVID. So of course you could spread it.
Have you ever seen another condition in all of your years of medical training that has become so divisive and that there are so many, I'm using air quotes, experts that seem to say, I know better than the professional scientists and medical experts?
David, it's really an amazing thing when you look at it. And the answer to your question is, of course, no. But of course, we've also never had a severely infective disease like this take place within our current information age, I'll call it, right? Where now you can literally at your fingertips, if you have a fast internet connection, less than a second, have access to thousands of things that are what? Sorted according to your preference. So what that means is you can search for whatever answer you want and find quite literally hundreds of thousands of things that will support what you just searched for. And I do believe that really we've never had a situation during this information age where that will become an issue. If you think about some of the more infective, dangerous things that have come along the road here in the last few decades, like HIV, for just one example, when that occurred, this kind of information was not so rampant and readily available. And so science had a chance to catch up before all of this information gets sent out, right? I was reading an article the other day written about sort of the downfall of the information availability and how many problems it causes, because information can be gotten so easily. Public health officials like me feel pressure to get information out there as soon as possible. And sometimes it would actually behoove us as a public health sort of community to let the science play out for just a moment before we start sending out information, because contradicting information causes doubt, right? And then naturally, now it drives more people to even go deeper into Dr. Google and find something that you said that was not true 3 weeks later.
And speaking of that, what is the strategy right now with trying to get those who have yet to get their first dose of the shot vaccine vaccinated? Because I know some cities are putting out buses to get people vaccinated and driving into those areas where the percentage is low, trying to get more, school age kids that are eligible, getting them vaccinated. How is that going? How's the strategy going?
Yeah, we've done any and all of those things actually from the very beginning. As you probably know, Parkland has mobile vans that we from the very beginning have sent into every neighborhood around the Dallas County, both for testing initially when there was no vaccine.
And are you seeing response from that?
Yeah, absolutely. But again, not to the level that we would love, right? I mean, you're talking about, okay, if I were to send one of my giant clinic vans, or I call them vans, but they're like buses, right? That go into neighborhoods, and we might do 10 a day. 10 a day is not going to do it. We would need more than that, right? We also, as you probably know, we have a partnership with Dallas Independent School District. We have clinics inside the schools, the Dallas Independent School District. So of course we have drives there as well. We now offer vaccines at every single one of our clinics. Before, as you recall, we centralized it all in Ellis Davis at the Ellis Davis Fieldhouse site. But now we have them in every clinic.
How close are we to the point of no return that people that haven't decided they're going to get their first shot just aren't going to get that first shot?
Yeah, David, unfortunately, I think we're pretty much there. So this is where we are now. And it's as evidenced by the fact that even with something like Omicron, our overall vaccination numbers really haven't moved. And if Omicron didn't scare you with the rapidity with which cases rose, then I don't know that anything will. We saw that during the Delta surge that did drive vaccination, but we have not seen any significant increase in vaccination rates during this wave at all.